Hello, this is Dr. Sonhyun Seok from Pleasure Plastic Surgery Clinic. Today we're going to talk about what's commonly called an upturned nose or pig nose. Doctors usually refer to this as a short nose. Let me explain a bit about this upturned nose. Actually, the opposite of an upturned nose is what's called a droopy nose or a long nose. So what exactly is the standard for an upturned nose or a droopy nose? For most people, it's easy to think of it as how much of the nostrils are visible from the front. If the nostrils look lifted like this, so if a lot of the nostrils are visible, you can just think of it as an upturned or short nose. On the other hand, if the tip of the nose droops down and hangs lower, especially when you smile or make facial expressions and the nostrils are hardly visible, then you can consider that a droopy or long nose. In fact, from a precise medical standpoint, when you carefully look at the human nose from the side, the specific angle that is formed by the very base of the nose and the distinct line of the upper lip is precisely called the nasolabial angle. Depending on this nasolabial angle, we actually distinguish between an upturned nose and a droopy nose, so you can think of this angle as the standard. So typically, for women, a nasolabial angle of about 95 to 100 or 105 degrees is considered ideal. If this angle is wider than that, the nose will be more upturned, pointing upwards. So the wider the nasolabial angle, the more upturned the nose becomes, and the narrower the angle, the longer and more droopy the nose appears, like a droopy or arrow-shaped nose. Creating the appropriate angle is an important part of nose surgery, especially tip surgery. As I mentioned, an upturned nose occurs when the nasolabial angle is too wide, making the nose look lifted. So lowering the tip of the nose is what we call upturned nose surgery or short nose surgery. Generally, upturned nose surgery is a bit more difficult than droopy nose surgery because when the nose is lifted like this, the fact that the nose is upturned means that there is less skin on the nose. In a situation where there is not much skin, you have to lower the tip as much as possible while overcoming the resistance of the skin, which is definitely more difficult than with a droopy nose where there is more excess skin. That's why, in general, you need to make the columella stronger, and you also need to dissect a wider area so that the alar cartilage at the tip of the nose has a greater range of movement. So this is a part that requires more meticulous, precise, and definite correction. The most difficult and severe version of an upturned nose is actually a contracted nose. When contraction occurs, the tip of the nose curls up like this. In a way, lowering this is one of the most challenging parts of nose surgery. In such cases, because very strong materials are needed, we usually use rib cartilage, either donated or autologous rib cartilage. For contracted noses, using your own rib cartilage is actually the best option. That's because it might be a bit more susceptible to infection, and you need to use the safest, strongest, and most abundant material, so in these cases, using your own rib cartilage is the right choice. People who feel that their noses are upturned or that their nostrils are very visible are actually considered, even in physiognomy, to have a less favorable appearance, as it's said that money tends to flow away from them. So in these cases, it would be a good idea to visit a plastic surgeon and have a consultation. And at that time, it would be best to choose a clinic with experience in this field and where they can perform the surgery with extra care.
Is there a particular face shape that is best suited for upturned nose surgery? Yes.
There are actually some people who ask to have their nose made a bit shorter, like an upturned nose. In fact, compared to the past, there are definitely more people who dislike the upturned nose look, but there are still some who want it. That's because an upturned nose with the tip lifted tends to make the face look shorter, smaller, and gives a cute impression. So it can make you look younger, and there are some advantages like that. On the other hand, a droopy nose, like a hooked nose, can make you look older and make the mid-face look longer, which are some drawbacks. Of course, having a nose that's just right is best, but some people think that a shorter nose is better than a longer one. In fact, one of my patients brought a photo of Yuna Ogura. Looking at her, her nose is quite short and you can see her nostrils a bit. She said she liked that cute look, and in reality, that style really suited her, a short nose. When done that way, it gives off a cuter, younger impression, and that kind of personality as well. There's a certain cuteness, a cute personality to that look. So for people like that, having a slightly shorter nose actually suits them. Of course, it shouldn't be too short, but within the normal range, going a bit shorter can work well for those individuals. So I think it's okay to reflect your own preferences or tastes. It's not that you must always lower the nose just because it's short. You should take into account your own preferences, but if the nose is turned up too much, it's definitely better to correct it.